I've just taken a call from a concerned client who is worried because their dog hasn't been themselves the last few days. The dog has been a lot less active than normal, hasn't passed any feces, and has just started vomiting. They're a young male who is otherwise healthy, and the pet carer has never noticed behaviour like this before. I've asked if the dog is a scavenger and if he has ever eaten things off the floor that he shouldn't. They've said he has a few times previously. As the dog is in pain and there are signs of gastrointestinal issues, we advise that the patient comes down. Whilst we wait for the patient to arrive, I suspect we may be carrying out a foreign body surgery. This is emergency abdominal surgery to remove an object stuck in the gastrointestinal tract. As the stomach wall will need to be opened, I select large abdominal retractors for the surgeon, as well as a general instrument kit and other equipment such as suction, flush, suture materials, and more. There is a possibility that no surgery will go ahead. However, as an experienced night nurse, I have my suspicions that this will be required, and I believe it is always best to over-prepare rather than be rushed at the last minute. I soon prepare the operating theatre, checking the anaesthetic machine has the right breathing circuit for the patient's size, as well as checking the oxygen is running freely and that there is enough anaesthetic agent in the canister. I finally leak test the machine. As the operating table is cold, I prepare it with bubble wrap, warm towels and blankets, as well as heating devices such as a heat mat and bear hugger. This is the bear hugger. It circulates continuous warm air within its blanket, helping to minimise patient hypothermia. The patient soon arrives and the vet takes them into a consulting room with their carer. Here, the vet will take a detailed history, take vital readings such as pulse rate, respiratory rate and temperature, as well as carry out other assessments to determine the patient plan. The vet suspects a foreign body is present, and so the patient is admitted and we move straight into action. Blood tests are first carried out. We take a blood sample from the patient to allow us to determine if anything else is going on, and also to check if it is safe for the patient to undergo an anaesthetic. We check both haematology and biochemistry references in the blood. These are all tested in our in-house lab machines and take roughly 10 minutes for the results to be available. The biochemistry sample is spun down in a centrifuge to separate the plasma from the red blood cell component of the blood. This sample is not actually from the patient we operated on, but this blood plasma is very yellow, suggesting jaundice, which I thought would be interesting for you to see. Our own patient had a healthy, somewhat clear-coloured plasma sample. The tests required are on these little slides, and we simply slot them on the machine, add the sample, and everything is good to go. Whilst the bloods are running, I set up all equipment needed to intubate the patient: breathing tubes, a tie, lube, and a laryngoscope to help visualise the trachea during intubation. Intubation allows us to maintain the patient on anaesthesia through an operation, as well as provide access to give emergency breaths if required. The patient will also have an IV cannula placed and fluids provided throughout and following the procedure. Once the vet receives the blood results, a sedation plan is provided and I draw up all the necessary pre-medication and other anaesthetic drugs. X-rays are set up once the patient receives their pre-medication, as we need to take X-rays in order to determine if there is a foreign body present, as well as where it is located. This will be vital for the veterinary surgeon when operating, to minimise unnecessary trauma to the patient and reduce surgical time. In the X-ray images, you can see where there is a foreign object, as it appears lighter on the X-ray, and below it there is an accumulation of gas in the GI tract. These images are not actually from our patient, but they give you an example of what it would have looked like. Now that we're certain the patient is going into theatre, I change into my theatre scrubs and put my scrub hat on. These will help to maintain sterility and aid infection control. The patient's stomach fur is clipped away and I prepare a surgical scrub so that I can clean the incision site ready for the vet. Again, this aids infection control, reducing the risk of contamination by microorganisms during the operative procedure. For this patient, a chlorhexidine scrub is performed. Whilst the vet finishes their hand wash and gowning up, I transfer the patient into theatre and carry out one more final surgical scrub. Shortly after this, the vet joins me and we're good to go. The role of the vet nurse is both to be an anaesthetist and also a theatre assistant. This is what the patient would have looked like during the procedure. You can see the use of a retractor to keep the abdominal wall open. As the vet focuses on the surgery, I need to focus on the patient and monitor them continuously through the operation. With the use of a multi-parameter machine, as well as my stethoscope and eyes, I monitor such things as ECG patterns, heart rate, oxygen saturation, and end-tidal carbon dioxide concentration through the use of capnography. Following these trends gives me an idea about how the patient is responding to the procedure and whether anaesthesia or pain relief levels need to be adjusted. The surgery takes roughly 2 hours in total to complete, and this is the foreign body which was removed. As soon as is appropriate, the patient is returned to their kennel, and I set them up on a recovery fluid rate, taking care to continue monitoring their vitals, particularly their temperature, as it can often drop throughout the surgery. Lots of blankets and warming devices are used to keep them warm. When they're awake enough, I give them some food to aid their recovery. Once I'm happy that my patient is safe, I return to theatre and clean everything away. The surgical instruments are removed and cleaned, and eventually sterilised again in an autoclave. Our patient will be returning home the next day with pain relief and recovery care instructions. This young doggy wasn't too happy in their kennel, and so I was able to bring them into our main prep area and give them a snuggle until they were calm. I hope you've enjoyed this video and learning more about the role of an emergency veterinary night nurse. If you are interested to find out more about what I get up to, please check out my other videos, drop a comment below and subscribe to the channel. Thank you!